Dr. Wade McKenna, a fellowship-trained orthopedic trauma surgeon who specializes in private practice in post-traumatic reconstruction, sports, and biologics. We've been using biologics in the practice of orthopedic medicine to augment, accentuate, and promote healing for over 5 years. The focus now is more directed towards the stem cell market, which is a huge growth industry in medicine, and is still an industry kind of looking for a home. Everyone still seeking the best answer, the best stem cell product, the best growth factor solution. What is the magic answer to activate stem cells? What is the difference between donor stem cells, autograft stem cells, amniotic stem cells, cultured stem cells? Those answers are just now beginning to come to light, which has prompted, and our research in that area prompted the formation of biologic therapies and prompted all the patent work we've done on the extraction device, because what we have found is that the stem cell by itself is important, but the stem cell without growth factors is just not the way the body does it. What we know with the natural healing of the body is that it is an activated mesenchymal stem cell, which includes FGF, which is fibroblastic growth factor, TGF-beta, which is transforming growth factor beta, VEGF, and IGF-1, IGF-2. It's a combination of these growth factors with the mesenchymal stem cell that the body uses to heal. What we're trying to do with the use of mesenchymal stem cell, and in our case, what we have found to be best suited in orthopedic injuries, especially surgical applications and non-surgical applications, what we have found to be best suited is bone marrow aspirate concentrate. Out of all the different stem cell products on the market, the only one that mimics the way your body heals is bone marrow aspirate concentrate. The problem with bone marrow aspirate concentrate had been obtaining it. The harvest techniques, the devices on the market, the surgical techniques of obtaining bone marrow were higher in complication, difficult to translate into an in-office setting, difficult to teach someone to avoid some of the complications of the procedure. And for the most part, most orthopedic surgeons, general surgeons, and podiatrists had never harvested bone marrow. The oncologist world of bone marrow harvesting is significantly more complicated than what most orthopedic surgeons, podiatric surgeons, and general surgeons felt comfortable adding as a regular part of their practice. What had to happen is take the harvest techniques that were available, well, still currently available, and the ones most commonly used are a jamshidi, which is a large trocar that is impacted into position with a mallet that causes fracturing. What we want and what we're talking about is the harvesting of bone marrow from when you harvest a bone. If you took a mallet in a trocar and you impact it into place, for that access to the marrow, which is where bone marrow aspirate comes from, you have to have fracturing around that hole. So you would have literally a caved-in wall of bone, and you have fracturing around that hole. Bone is coated with a layer of tissue called a periosteum. It's like wrapping cellophane around something. That periosteum is what helps promote healing, and and especially in children. It's extremely thick in children, and it gets thinner as we become adults, but it's still there. So if you fracture through that, even on purpose, create that hole, and those little splintered fractures around it, the microfracturing around that hole, leaks blood underneath that periosteal layer, it causes a subperiosteal hematoma. It's painful, it can take months to resolve, and it puts you at risk of an infection. What we needed to find is a way to harvest bone marrow aspirate concentrate without the complications of the harvest of bone marrow aspirate concentrate. Most bone marrow aspirate is harvested from the iliac crest at the top of your hip. Those harvest techniques are painful, complicated, and not commonly part of the regular surgical procedure that's accomplished. What we wanted to do is take bone marrow aspirate harvesting, change the technique, decrease the complications of the medical morbidity of the technique, and at the same time find a way to get a better cell count from the harvest of bone marrow. With the techniques available now, even with the iliac crest, when you impact a trocar in the iliac crest, you can promote clotting, cell activation. It's a traumatic harvest. It's not very fenestrated. The fenestrations, or the holes within that catheter, are not radial cuts, and there's no way to create a draw zone, meaning you want to create, and the analogy I use all the time is if you had a straw and you were going to try to get a drink, would it be easiest, you turn on the faucet, would it be easiest to stick the straw in the running water and try to get a drink, or would it be easiest to put a cup underneath the running water and then drink from the cup? There's no product on the market that gave us that cup to draw from. What we've designed with biologic therapy is the BMAC catheter that we've patented with different links and different radial cuts for the fenestrations and the harvest, and actually have added an in-office technique because of the nature of the catheter itself. What we've added is a plunger. So when you insert the catheter, and I use the word insert rather than impact like you do the Jamshidi or any of the other needle products on the market. The difference with the BMAC catheter, the biologic therapies product, is that we are creating an aperture or a window, a round opening with a truly round cut because of the shape of the tip that is accomplished with a high-speed drill, not a mallet. It limits the fracturing of that bone and makes it more of a drill hole insertion. So now we have a round portal without the liberation of the fracturing around that area, without the limiting the probability or possibility of subperiosteal hematoma, cutting down the amount of pain that the patient experiences, not only at the time of the procedure, but also days or weeks after the procedure. By doing that, it also limits the risk of potential infection. More importantly, and the reason the catheter is designed so that it is, by putting this plunger distal to the tip of the catheter, what we've done with this drill tip is we've created that draw zone, that cup that we're looking for distal to the tip of our catheter. That draw zone is one of the true important differences in harvest techniques, because what the goal of a bone marrow harvest is a high cell count. We want mesenchymal stem cells. That's the reason to go to bone marrow. The best reason to go to bone marrow for your mesenchymal stem cells instead of cultured cells, which are illegal in this country anyway, in the human market. For some reason, our governments chose to call that gene therapy. And if you're a vet, it's the standard of care currently in the vet market is harvest some stem cell, send them off to a lab for two to 3 weeks to be cultured, cell numbers and counts expanded, pack them in plasma, which the reason I mentioned that is I'll reference here in a minute, and send those back to the vet for implementation into the animal. What's wrong with that process, or what we can do better than that process, is, again, we're interested in obtaining the stem cells, and we want a high stem cell count, and we want decreased clotting, which is the reason for this catheter, rather than the traumatic impaction through the cortical wall of a tibia. We want to decrease the amount of clotting because clotting lowers your cell count. More importantly, bone marrow is 97% whole blood. And when you spin down whole blood, or in our case, bone marrow aspirate, what we're looking for is there's 9 different growth factors. And we can get baseline counts of those 9 growth factors at about 15 times baseline. Those growth factors are crucial and important. The growth factors we're talking about most with mesenchymal stem cell volume are FGF, VEGF, IGF-1, IGF-2, and transforming growth factor beta, TGF-beta. Those growth factors in combination with the mesenchymal stem cell are the key to promotion of healing. The reason, and we'll go back to this point, but the reason that culture stem cells packed in plasma are stem cells, the viability is questionable, but more importantly, there's no growth factors. It's the seed on barren ground. You want a fertilized, plowed, ready to harvest field. When you plant the seed, you need the growth factors and the fertilizer and the environment that's conducive to that promotion of growth. What we've done with the growth factor and the spin process and the harvest process of bone marrow concentrate, the difference in this stem cell is this is how the body does it. Every other form of stem cells that are artificially or cultured or from an allograft source is not how the body heals. What we're trying to do is just promote the natural way that the healing tissue heals, which is a circulating mesenchymal stem cell acts as a chemoattractant to the tissue, which promotes increases in growth factor concentration, which those growth factors act as coenzymes in promotion of the local tissue response. The hemopoietic stem cell acts as the angiogenic factor to help the blood supply to the injured or the area that we're trying to get to heal. That's how the body does it. All we're doing with the stem cell is to try to promote that or flip the switch to try to turn that process on. The only way the body has of turning that process on naturally is the use of the circulating mesenchymal stem cell that you have. That's the reason children heal better than adults. That's the reason immunocompromised adults don't heal as well as healthy adults. That's the reason diabetic adults, chronically ill, liver function, renal patients, those immunocompromised subset of patients, the circulating mesenchymal stem cells go down, the amount of growth factors in your blood concentration drop, the hemopoietic factors from bone marrow change. We can accentuate all of that with bone marrow aspirate concentrate. All we're doing is tilting the scale to the right with the natural promotion of what your body's already doing. That's the crucial difference with bone marrow aspirate concentrate obtained stem cells, is we want to increase your body's own natural ability, or in an adult, the inability. We want to change and promote chondrogenesis. In an adult, the growth of articular cartilage for an osteoarthritic lesion is very difficult and doesn't happen. What we have found a way to do is tilt the scale to our favor with chondrogenesis to promote articular cartilage growth. The standard of care in orthopedic surgery for an osteoarthritic lesion in the knee, and osteoarthritis is a billion-dollar industry just with over-the-counter medications. Billions and billions of dollars are spent on over-the-counter osteoarthritic medications for pain and joint stiffness. Pain and joint stiffness is caused by an osteoarthritic lesion or wear. The only way to change the paradigm on that would be to regenerate the worn and torn articular cartilage on the joint. There's no way to do that in an adult. What the standard of care is right now, arthroscopically, is you scope the patient's knee, you clean out the worn debris, you take care of the meniscal tears, and on the osteoarthritic lesion or the osteochondral defect, that portion of the joint not covered by cartilage anymore. And what you need to know is at the end of a knee, on the tibia, this surface, on the femur, the round surface, just like when you pull a chicken leg apart, it's got that nice shiny white covering on it. We have that too. That's osteoarticular cartilage. That chondral surface is, while you have cartilage, you don't have arthritis. As you wear through that chondral surface, you have osteoarthritis. If you have a traumatic defect in that cartilage from an injury, a fall, a worn area, a twist or a turn, years down the road, that worn area, the area that doesn't have very thick cartilage, that's your osteoarthritic area. In orthopedic surgery, we create a microfracture. We peel the surfaces around that, get it down to a more full surface lesion that may help promote healing, And through a series of several drill holes in that chondral lesion, the liberation of a few drops of bone marrow is a sign of a successful microfracture, and that promotes a healing covering on the end of that bone. That's the standard of care in orthopedics. That cartilage healing is a fibrocartilaginous matrix of tissue. It's not hyaline cartilage. Bone is covered with hyaline cartilage, and that's what we're looking to regenerate. Even after microfracture, you don't form hyaline cartilage. The covering that you get, that fibrocartilage, is better than nothing, but that's what promoted the research on this catheter and bone marrow, is with microfracture, if several drops of bone marrow make a difference, what would the genetic equivalent of 60 cc's of concentrated growth factors and bone marrow do for that knee? That's the reason we harvest 60 cc's of bone marrow, in some instances more, up to 180 cc's. We're able to spin out the growth factors. We're able to spin out the stem cells. We can get over 1 million mesenchymal stem cells from a harvest in a matrix, not a cultured million stem cells in plasma, but 1 million stem cells in a slurry of FGF, TGF-beta, IGF, VEGF. That's how the body does it, and that's what we're trying to promote with bone marrow aspirate concentrate, is the healing of articular cartilage in the knee. Now, because of the host environment we add the bone marrow aspirate concentrate to, what I've been talking about is the osteoarthritic lesion in the knee. That same line of thinking drives bone marrow aspirate concentrate in the healing and regeneration of a tendon, in the healing and regeneration of a muscle, in the healing and regeneration of nerve roots, in the healing and regeneration of bone. The widest spread use of bone marrow aspirate right now is in bone. Bone marrow aspirate concentrate, as its osteogenic potential, is what started the bone marrow market. Bone marrow not concentrated helped bones heal. Bone marrow not concentrated is the main active ingredient in the graft that we use to heal a spine fusions or to heal a non-union fracture. What we've done with bone marrow aspirate concentrate is concentrate those osteogenic factors, and in that host environment, generate more rapid response and healing of bone. That same line of thinking, that same line of treatment helps with tendon, muscle, and articular surface. So what we've talked about is now the chondrogenic potential of mesenchymal stem cells. And again, we're not just talking mesenchymal stem cells. We're talking specifically bone marrow aspirate concentrate, mesenchymal stem cells in a slurry of growth factors. That is the key. Osteogenic potential of those cells. And by osteogenic, we mean forming bone. And with osteogenic potential, we're talking about small joint fusions. We're talking about non-union fractures and trauma. We're talking about spine fusion, cervical spine, lumbar spine. Those areas where you need bone to grow and we need to help the body along, bone marrow aspirate concentrate is the answer. The key is, and what we touched on a little bit a minute ago, is the things that aren't legal in the United States, where it comes to the harvesting and administration of stem cells. The good news is that's not the best way to do it anyway. The better news is there wasn't a way for a point of service delivery method of the harvesting, the concentrating, and the re-administration of stem cells, the bone marrow mesenchymal stem cell, in an in-office setting or at a point of delivery setting, because there wasn't a great technique for harvesting it, there wasn't a great technique for concentrating it. Biologic therapies, BMAC catheter, changes that whole paradigm, because now for an in-office delivery of bone marrow aspirate concentrate, the harvest of mesenchymal stem cells, the concentrating of mesenchymal stem cells, hematopoietic stem cells, and the growth factors we're looking for is all possible at a point of service, in a point of service application. That beforehand has never really been done. What that does is all these non-surgical applications of bone marrow aspirate concentrate that we're seeing in the literature, chronic lateral epicondylitis, chronic medial epicondylitis, chronic infrapatellar tendonitis, chronic rotator cuff tendonitis. Those are extremely difficult problems to treat. They come with a significant paradigm of treatment involving anti-inflammatories and steroids, all of which have deleterious side effects on your stomach or on the healing potential of that tendon in the case of steroids, or in the increased risk of infection. Bone marrow aspirate concentrate at a point of service type of treatment for those chronic kind of injuries in the office, there was no way to really do that. It was still a surgical problem, even with the harvest and administration of the stem cell. The BMAC catheter from Biologic Therapies changes that, because now we have an in-office harvest technique focused on the aspiration of bone marrow. With the biospin, we have a concentrating effect of bone marrow aspirate concentrate. So we have obtained samples with cell counts in the millions from an in-office harvest or from an intraoperative harvest with less morbidity and less side effects and higher cell counts with this catheter. That point of service delivery, instead of harvesting stem cells at a time of surgery, concentrating and bringing back. Now, in the operative suite, the bone marrow harvest is concentrated, is aspirated as the patient's going to sleep. By the time that the surgery is over, bone marrow aspirate concentrate is available for, in rotator cuff, the accentuatum healing, in a non-union fracture, the injection into the fracture site with the fixation device, in a spine fusion or small joint fusion, the addition to your bone graft or to the joint surface to help promote that healing. All that's possible at the time of the service is provided. And in an in-office setting, those treatment or those chronic nagging injuries is now possible because we can obtain a high quality aspirate with a high cell count and concentrated growth factors. And before Biologic Therapies BMAC, there was just no great way to do that. All the other harvest techniques are either too traumatic, they cause so much clotting that the cell count drops, or the allograft sources of stem cells don't have the growth factors we're looking for. This is really the first time that a point of service delivery of mesenchymal stem cells, hematopoietic stem cells, and growth factors has really been possible, especially to the level that you can actually promote and change the paradigm of treatment. We're going to lower the phases of healing in the beginning. We shorten all those phases of healing and prolong the regenerative phase of healing. And it's all about the regenerative potential of bone marrow aspirate concentrate and growth factors. So really, what we're talking about is a market as a whole in the biologic market in medicine. It's the largest growing segment of medicine is regenerative medicine in healthcare. We want to not just surgically fix a lesion, we want to heal a lesion. Regenerative medicine and biologics is the way to do that. Biologic therapies, with the addition of the BMAC catheter and the biospin bone marrow aspirate concentrating device, the centrifuge, changes the paradigm of treatment with biologics, because now, for the first time, we're providing in an in-office setting the delivery of concentrated bone marrow aspirate mesenchymal stem cells with the hematopoietic stem cells and growth factors necessary to help you heal and promote chondrogenesis, osteogenesis, the formation and healing of tendons. All that's possible in the biologics industry. It's just never been easy. There's never been a harvest technique. There's never been a concentrating device that can get the growth factors and the cells to the level that is now possible. Okay. So the key, after all the basic science talk and the techniques, is biologic therapy as a company, and these products, the BMAC catheter, the biospin centrifuge, are revolutionizing healthcare. We're changing the paradigm of treatment in regenerative medicine. We're adding biologics to every portion of the medical industry where it can make a difference in patient care.